Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now, let's move on to the latest Celiac.com news. Blood pressure drugs may worsen gut problems in people with celiac disease. Researchers recently set out to answer an important question. Among people with celiac disease, do those who take a common group of blood pressure drugs, called angiotensin receptor blockers, experience different health outcomes compared to those who don't? The findings suggest they might. The study showed that individuals with celiac disease who use these medications were more likely to experience anemia, iron deficiency, abdominal pain, and chronic diarrhea. These results raise concern that such drugs could worsen intestinal health or mimic symptoms of active disease, even when patients carefully follow a gluten-free diet. Doctors have long known that one specific drug in this category, olmesartan, can sometimes cause a gut condition that looks strikingly similar to celiac disease. People who take it may develop diarrhea, weight loss, and intestinal damage nearly identical to that caused by gluten exposure. Because of these similarities, researchers wanted to know whether other drugs in the same class might have similar effects, particularly for people already living with celiac disease. To find out, they analyzed medical records from nearly 2,000 people diagnosed with celiac disease. A few hundred had been prescribed angiotensin receptor blockers, while the rest had not. The researchers followed both groups over time, tracking key outcomes such as low blood count, iron deficiency, and recurring intestinal symptoms. They also adjusted for other factors like age, gender, and health conditions to ensure a fair comparison. Their analysis revealed clear patterns. Those using the blood pressure medications were more likely to have lower hemoglobin levels, suggesting anemia, and higher rates of iron deficiency, which can indicate poor nutrient absorption. They also reported more frequent abdominal pain and diarrhea. Together, these findings point toward the possibility that these drugs could interfere with gut function or amplify inflammation in people with celiac disease. Why might this happen? One theory is that angiotensin receptor blockers affect how intestinal cells communicate or heal. In celiac disease, the small intestine is already damaged by inflammation triggered by gluten. If these medications further disrupt that delicate balance, they might make it harder for the lining to recover. Another explanation involves the immune system. Some of these drugs, especially olmesartan, may provoke immune reactions that harm the intestinal tissue directly, though such cases are likely rare. For people living with celiac disease, this research highlights an important reminder. Managing the condition involves more than avoiding gluten. Medications can also play a role in gut health. That doesn't mean everyone taking blood pressure medicine should stop, but it does underscore the importance of reviewing prescriptions when symptoms persist. If someone continues to have abdominal pain, diarrhea, or unexplained anemia despite a strict gluten-free diet, it's worth discussing their medications with a healthcare provider. Alternative blood pressure treatments may be available that are safer for sensitive digestive systems. The study has some limits, as it relied on medical records rather than controlled testing. This means it can't prove that the drugs directly cause intestinal problems. Other factors, such as underlying heart conditions or differences in general health, might also influence the results. Still, the pattern was strong enough to suggest that further research is needed to better understand this connection and identify which specific drugs or doses might pose the greatest risk. Ultimately, this study adds an important layer to our understanding of celiac disease. Even with perfect dietary adherence, outside factors, like medications, can influence recovery and well-being. For doctors and patients alike, it's a call to think holistically. When ongoing fatigue, nutrient deficiencies, or digestive problems occur, gluten may not be the only culprit. A thorough medication review can be just as critical to restoring health and improving quality of life for people with celiac disease. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.